Welcome this afternoon to our Think Global event. I have just a few announcements to run through before we start. If you need RCR credit for this seminar, please don't forget to sign in on those sheets. And if you're online and you need RCR credit, please email Kelly Beal. We have attendees both in person and online, and we're going to record this and it'll be posted in a few days. So just a brief note about the format. We're going to kick off with a speaker. She's going to lead us into this conversation with her presentation, followed by a panel discussion where we have two panelists who are going to join us online. And we're going to be able to explore this issue more in depth from different perspectives. We welcome audience questions during that panel portion of the session. I also want to extend an invitation, particularly to our students. If you're available immediately after this session, we're going to gather outside with some coffee and some refreshments and have a time for more informal interaction with our speaker. So please come if you're available. So the topic of our Think Global today is extractive global health data as a commodity. And at DGHI, we've been exploring issues of data collection, data use, and data sharing within our research partnerships. And this reflection was really triggered by conversations that we were engaged in across the institution about data ownership, research data ownership, as well as our continuing engagement in the decolonizing global health conversation. And at times, these conversations really seem to conflict. They seem to be at cross purposes with each other. And so we began to appreciate more fully data as a resource that's generated within our research partnerships. And we could see that activities where data was being collected in one place, removed from the context, and value being extracted from it for sort of personal or financial benefit really has very strong parallels with the kind of resource extraction and exploitation that characterize colonization. And so we felt a need to more deeply examine the ways that we use and share data to ensure that our practices are a reflection of our core values and the core values of our partnership. So in pursuit of this value-driven research data governance, we remind ourselves that data should not only have maximum benefit to society in general, but should also benefit the communities where the data was collected. And that communities should be empowered to be part of the story that's being told with their data. And they should be empowered to use the data, to consume the data for their own benefit. And that we need to address issues around data ownership or sharing that undermine the equity in our partnerships. So with these thoughts, we have invited Dr. Bethany Hedt-Gauthier to join us and help us push this conversation forward. So Bethany is a biostatistician who collaborates on health systems research to optimize care and outcomes. And her work is primarily focused in sub-Saharan Africa. And part of her portfolio includes the study of equity within these global health research collaborations, including building and evaluating training models for in-country research. And she's been recognized for these efforts, including leading teams that received the Statistical Partnerships between Academia, Industry, and Government Award from the American Statistical Association, and the NIH's Technology Accelerator Challenge Prize. So please join me in welcoming Bethany for this conversation.
Thank you very much. I am honored to be here. This is a homecoming for me. If you didn't know that, I grew up outside of Charlotte and was able to see my parents yesterday. So it's really grateful to have this opportunity to be here with you. And also, usually when I give talks about data, not that many people come. So I'm really excited that you're appreciating this focus and this conversation on the topic. So thank you for having me. So as a statistician, as a lover of data, when this open data movement started, or when I was pulled into the open data movement, I really wanted to be pro-open data, and would go to these conversations and want to espouse those values, but struggled. And there was a tension there for me that I've, over the last decade, had a hard time articulating. But then, as I've struggled with it, tried to form some ideas And really what it's come down for me is in a world without power dynamics, I am pro open data. And so we really can't talk about open data in the context of global health if we don't talk about the power dynamics that exist within global health that can really lead to some unintended consequences if we just make all data open access. And so I'm going to try as briefly as I can take you through some of the thoughts that have led me to this hypothesis. I also want to, or to the statement, I want to give credit. I mentioned this stance at a meeting I was at a couple of weeks ago to two colleagues that were new to me, Lisa Fazio and Neil Lewis Jr., and they talked about some of their work in this space, which is focusing on community partnerships in the US. And I do think it's really important that we think about the parallels between open data and open science as it's practiced in community partnerships in the US and in the global health context. And I think we have a lot to learn from the leadership of their work in this space. So a couple tenets that I want to put forth in this talk. So the first is that research is a field full of commodities. And what I mean by commodities is that these are things that can be earned. These are things that can be bought. These are things that can be traded. And we don't typically think about these as commodities the way that we might think about gold or diamonds as commodities, because they're not necessarily tangible products, or they're not necessarily things that we put value, like explicit value to. But the reality is there are commodities that hold value in the field of global health, and that these commodities are not always equally shared. So on the previous slide, had that authorship as a commodity in global health as something that holds a value in global health, even if it's not explicitly defined. And this is a paper that we published a couple of years ago that looked at authorships on health, papers about health in sub-Saharan Africa. And what we found is overall, over half of the co-authors were from the country that the research was about. But if you included a collaborator from a high-profile, high-income country institution, for example, Duke, Harvard, as soon as you included one of those collaborators, the engagement of local co-authors dropped. And it dropped, if you look at the graph, most pronounced in the prize authorship position. So you'll see the biggest deficits between overall and those that include collaborators from high-profile institutions in the first and senior authorship positions. So these are things that aren't just equally shared across groups. And specifically in global health, this is often extractive, the way that we share these commodities. And so I went back, and there's a particular podcast that for me has been really, again, talks through these concepts of extraction and identity. And I had to track it down. And what I realized is when I was trying to track down the podcast for this talk, I had to go through Twitter's like my archiving system now. So I had to go through various tweets to find it. And just by coincidence, the origination of me finding the podcast was directed to Decolonize, to myself and to Sheye Mbambula, who I know many of you are familiar with his work in terms of talking about equity in this collaborative space. So Sheye replied, not what you'd expect, but I'm a huge fan of Dolly Parton, and this particular podcast talks a lot about identity, collaboration, extraction. And so I want to point you to this podcast, and I just retweeted it yesterday so that it would be at the top of my Twitter feed for you to find. Because even though it's not about global health, as Sheye says in his tweet, it really does talk about what it means to be extractive in a field where things that may not have explicit value, you are taking them to for your own benefit. So what leads to the space where things can be extracted, where things are not equally shared, where commodities are not necessarily earned, but are given in ways that are unfair or unjust? And this paper by Schiffman goes through 4 forms of capital that really shape power dynamics in the research space in general and global health more specifically. And one of the points that I've really landed on is when we talk about how these different forms of capital influence how we share data, how these forms of capital influence how we decide who's a co-author on a paper and what positions they hold, how they influence who we invite to give talks at various events. When we think about this, these forms of capital are very much influenced by colonialism, racism, and sexism. And so we can't talk about data as a commodity and sharing data openly without talking about how the power dynamics that influence how those things are shared are very much rooted in the history of colonialism. So just trying to be a little bit, that's basically the premise that's gotten me to this hypothesis or this statement of, in a world where there were no power dynamics, I would be pro open data. The question is, how do we move forward in this space to work towards, as rigorous science as possible, that's as inclusive as possible. And so I'm going to talk about some of our own work and specific steps that we've taken to move this forward. So one is the naming and sharing of commodities. And so what we try to do in our own practice is to be very explicit about the various benefits that our research benefits, and to put them on paper and to actually talk about what's fair, what's just, what's right. And so the example here is from some of our global surgery research in Rwanda, specifically related to C-sections, where as soon as we have an idea for a paper, we list it and we have team conversations about, okay, who is the best position to lead this paper? Who has been in our space that hasn't had an opportunity to lead a paper? Does that person have the resources that they need to be able to lead this paper? If not, what type of mentorship do we provide? And so we're very explicit in terms of mapping out the opportunities that exist within our partnerships and trying to be as open and transparent and fair as we can in sharing those opportunities. So this is specifically an authorship, but again, it translates to data because, for example, some of these papers are related to some machine learning work where we've captured images and diagnoses in Rwanda, where we're relying on partners at MIT to help us with the more technical aspects. But we need to, even in those conversations, think about, where did this data originate? How do we make sure that the people who are involved in the generation of this data, that they're involved in the interpretation of the results? And so being explicit about it has been helpful in our partnerships. The second is taking time to detail the governance structure. And I put forth here an example from a partnership that we formed related to COVID-19, where, so most of my work has been in Rwanda. I've been working with Partners in Health in Rwanda for 12 years. But at the start of the COVID pandemic, we realized that many Partners in Health sites had similar questions related to what was the burden of COVID and how do they best respond to the pandemic in their context. And so we tried to unify activities across the site so that we could be as efficient as possible. But the challenge is, a lot of people didn't know each other. A lot of people didn't know me. So who am I to come into this space and just trust me, this is all going to work out for the best. So it was a lot of slowing down to go fast. We took the first 2 months of the pandemic just thinking about, what does this look like for us? Who's contributing data? Who has access to that data? If someone else wants access to that data, what permissions do they have to have? If we're going to write a paper about this, who should be leading that paper? What does co-authorship look like? And for us, taking the time to really spell that out at the beginning meant we didn't have to trip up and have that conversation for every data share, for every paper written, that we were able to, by slowing down and specifying this in writing, move faster. And this was what led to the American Statistical Association Award on Partnership and Collaboration that we received this year. We're quite proud about. An extension of that work, which is being led by my colleagues, Nadine Karima and Vincent Chibaka, is thinking about now, how do we make this continue past the pandemic? And this is specifically related to the data use and data sharing and data governance. So what they're trying to do in this funding is to create an infrastructure where various country teams can provide data into a centralized database, but then to think about the governance around that, where any country team can access their own data, right? It's their data, they own it. So once it's gone through data cleaning and some harmonization, that country teams can extract their own data without any regulation or restrictions to those country teams. But if someone were to come in and say, I would love the data from Rwanda, Malawi, and Sierra Leone, then we have a governing board of community members who can say, oh, that's a question we're really excited about. We would love to pursue that with you. And this is what that partnership looks like. or to also say that's not a priority for us, and so we're not going to share the data with you at this time. And then the other part that we've added to this model is to specifically provide training to support data use at country sites. And so one of the things that Vincent and Nadine will lead over the next 2 years is a data extraction request where country teams are mentored to know what's in the database, to formulate research questions around that data, and then to get the statistical training support if needed, or the writing support if needed to actually take that data and turn it into a research paper or research finding. Related to that, a large part of my career has specifically been around trainings for data use. And so thinking about, again, when the capital that forms who has access to things and how those things are fairly or unfairly shared, a lot of it is around the skills to be able to use things or the credentials to be validated in the space. And so we do a lot of training work. That was my original call to Rwanda when I moved there. And so I give you some examples here of formal training programs that we do. So for example, the multi-country research capacity building training program, where we take people from ideas to paper over the course of a year of training and mentorship. But also on the right side, some informal opportunities that we pursue to facilitate this. So these are 2 students of mine, one who's a Harvard student, one who's a University of Rwanda student. They've been working together in close partnership over the last year. They were able to spend the summer together, and then together they actually taught a course in Rwanda. And so there are so many opportunities that we have here to invest in using data and making sure that folks who are interested to answer questions with their own data are have the skills and resources to do so. And then I want to offer as a 4th and final recommendation to work for change within our own institutions. And so we've talked a lot in the group here about the tensions with data use agreements and the restrictions and the very conservative language of my institution and how that's orthogonal to our goals in terms of partnership and fair data sharing. And one of the things that has really been useful for me is to just create a really strong relationship with the woman at my institution who's responsible for generating these and helping her understand what are our concerns, what are we working towards, why is partnership so important to us. And so with that, we've been able to edit the DUAs, something that oftentimes is presented as impossible, edit the DUAs to reflect our values within the DUAs in a way that still aligns with Harvard's required language and technical details for the DUAs. So create allies where you can, and then shape cages where you can. So one of our big challenges is how promotional processes are oftentimes misaligned with our partnership goals. And so we've been doing a lot of writing and advocacy around how we need to change the academic promotion processes to better align to equity and partnerships and multidisciplinary collaborations. And this is not always a smooth pathway within my own institution. And I think it's directly aligned with some of the conversations you're having here around data use and data sharing here. And sometimes you just need to elevate the issue and shake a few cages to hope that that change can be made. So there's lots of outstanding questions in this space, and I look forward to the panel to exploring. When we met last week, these were some ideas that we brainstormed within the group that you'll hear from in the panel, but thinking about things about how data policies, open data policies are developed, and how do we work to advance knowledge and protect communities and engage communities. What are the roles of funders and publishers in the open data movement? And what do we do when our values are misaligned to their stated requirements? And then finally, is there an economic evaluation of the data? And how do we value an abstract commodity? And I know Osondu, who's on the panel, brought up this idea, may have some thoughts here. But again, this for me is a work in progress. So any feedback that you have, I look forward to exploring that more with you in the next hour. Thank you.
Thank you so much, Bethany, for sharing those insights. We're going to welcome our other panelists who are joining remotely. So we have Dr. Osondu Ogbuoji, who's an assistant professor at DGHI and the deputy director of the Center for Policy Impact and Global Health. And his primary research interest is in making health systems work for the poor. And part of this work includes using large country data sets to explore causes of disparities in maternal and child health. So welcome, Osondu. And then I'd also like to welcome Dr. Thiago Hernandes Rocha, who's an advisor on health data analysis for the Pan American Health Organization. And his area of emphasis is in public policy evaluation and data mining in health, including geoprocessing, structuring of health information technology, and big data and data science applied to management. So we're really excited to have these two additional perspectives to flesh out some of this conversation. So just a reminder that if you have questions, we'll take a few questions in a minute. And if you're online and you have questions, you can put your questions in the Q&A box. Somebody's monitoring that. So I'm going to use moderator's prerogative and launch into this with my own questions first. So if our ultimate goal is to really foster equitable collaboration and prioritize benefit to the communities who contributed the data, what does an equitable data practice look like? And we have, it's a huge question because there's so many things that influence data governance, right? But we have some really interesting contrasting perspectives. We have you who sort of embarked in a research collaborations that prospectively collect data about human subjects. We have Osondu who uses data that's generated by health systems and public health systems in a country context. And we have Thiago at a non-governmental organization who's aggregating data from many different sources to try to address public health priorities at sort of a multinational level. So I'd like to hear from each of you your thoughts on what an equitable data practice should look like. Maybe Osondu, do you want to go first?
Sure. Thanks, Wendy. And it's a pleasure being on this panel with you all. I think from my perspective, I think that equitable data practice should be such that if we were on the receiving end, we would like what's happening. And in one of the discussions that I had in one of the countries we work in, someone asked me imagine if there was a lower middle income country doing research in a high income country, what would that look like? Will they let you just go into their population, collect data? Yes, you're going to give free healthcare, but collect the data, then store that outside the country, and then use it whenever you want to without your partners in the high income country. To bring this home, just think about any country in Latin America or Africa or Southeast Asia doing that to the US. To make it even more stark, right? Imagine if it was the government of that country that was sponsoring the research. I know that that's pushing the boundaries of the discussion, but then that tells you the way that this might be looked at. And so if we're going to practice equitable data practices, we should do whatever we do should be such that if we're on the other side, we will feel comfortable with that. Now, we may not be there yet, but if we're moving towards there, that ideal scenario, I think that's great.
That's really helpful. Thank you, Osondu, for discussing it in that way. What do you think, Thiago?
I think that equity is strongly related with the understanding that not necessarily one size fits all. So when we are thinking about engaging different partners, different countries into data collecting initiatives, it is very important to engage the local authorities so they can be part of the process. They can understand what will be the benefits of it. And it is important to gather the local needs, the local perspective, and involve researchers, Ministry of Health, any health-related representative involved into this data collection process, so you can try to get what is important to address the local health challenges they may have. And as Osondu highlighted, the approach to go into a country, collect data, and produce research, grant proposals, and manuscripts, several times is done without considering how this type of solutions, the type of proposal, can be applied to address the local health challenges. And when we are doing this, we are adopting the perspective of someone from a high-income country, someone funded by large agencies that is interested in producing results and producing manuscripts and getting additional grants. And it is also important to kind of foster this equitable use of data to take into consideration the possibilities of apply the results of these efforts to address the local needs. And to be able to do this, it's very important to hear what are the needs, what are relevant matters coming from the countries that are providing data, from the population that is providing data, because several times this approach can leverage and produce much better results, including the perspectives of the community. And exactly by engaging these stakeholders into this process, we can try to avoid this one-size-fits-all approach that is very often applied, as Osondu highlighted, in some countries of Latin America and Africa when we are discussing about data collection process.
Yeah, that's right. Thank you. What do you think about Osondu's framing of this this question, Bethany?
I think it's great. I absolutely agree. Osondu, I think when I was formulating my thoughts, which were very much related to your framing, for me, equitable data practice is being able to have a real conversation. And I guess, Thiago, to your point of like, it's not a one size fits all. So maybe what's good for one partnership isn't good for another. And as I was formulating that thought, I thought about all the times where, someone would say, well, this is what's possible, or this is what we want. And I would go, well, that's a terrible idea. And then I'd have to check myself and think, well, is it a terrible idea for the advancement of science? Is it a terrible idea for the populations we're serving? Or is it just like a terrible idea for me and my institution and what I'm trying to do? And a lot of times I do think something about your point of, if I were to ask this of a colleague at Boston Children's Hospital, how would I ever make that request to them? And so I think your framing is a helpful check for me about how I operate in this space of if I have a certain request or a certain reaction to something, is that reaction the same as if it was coming from someone who was, sitting down the street from me? So I think it's a really helpful introspective framing as well.
Osondu, I wanted to ask you a little bit more about the conversation that we had about placing value on data. How do you place almost an economic value on an abstract commodity, and why is that important?
Yeah, thanks, Wendy. So I think that first we need to recognize that we live in a world where access to information is key. And whoever has access to information has a competitive advantage over someone who does not have that. Businesses have known this for a long time, and they invest a lot of money in building data capturing and information systems. Even within the health system, we have the for-profit part of the health system. And when I say for-profit, I mean like the health insurance companies, big pharma, hospital systems, where there's a very close, they closely monitor the bottom line. They invest in these very strong, robust data systems with an aim to learn. But unfortunately, when you think about the nonprofit parts that are largely donor-driven, that has not caught on so much. And also in the public sector, And it's not without reason. Sometimes when you are talking to a policymaker, the policymaker has to make a decision. Where do they invest their next dollar? Should it be to buy a mosquito treatment net that will save one life, or should it be to build a data system that you're not going to know whether it takes care of whatever tangible benefits it's going to get? And that's not a good place to be. So I think that it's not clear to a lot of people what value data systems provide in this nonprofit space. But we know that there is value. Otherwise, the for-profit entities will not be spending a lot of money to do that. And I think that one of the things that we need to do more of in this space is to educate public policymakers, educate donors about the value. One of the things that, one of these types of studies that are possible include like cost of inaction studies, where you can say, if you don't build a data system, what does it translate to down the line? If you have to continue to learn things afresh and you don't have a system that ensures that a lesson learned once goes on and is not repeated in the future, what's the economic value, or what are the productivity gains in the future? I think that that's one way we can begin to make progress in this space. Another idea will be to borrow a leaf from the monitoring and evaluation community and how they were successful in convincing donors that the success of a program depends on proper monitoring and evaluation. And then within short order, most donors now required that every grant must have a monitoring and evaluation plan. So having those kinds of discussions with donors and even public policymakers, for them to see that it may seem like this is not a good investment today, but in the long run, you're going to actually be able to have a strong, resilient health system. And I'm really talking from the country perspective, because this cannot be done by donors alone or by external actors. It should be really driven by countries themselves.
Yeah, that's a really interesting point about the, the sort of emphasis on M&E that's evolved over the last like 10 years, and how important, how central that is to how funding decisions are made, and gives us clues about how to push that forward. Maybe we could take some questions from Trent or from, please.
Hi, good afternoon. I'm Pramod Chandna. I'm the Chief Operating Officer for Wine to Water. It's a global NGO. And just to the last speaker, on the nonprofit side, we are in many countries in Latin America, in Africa, in Asia. And the impact of data on the growth of the NGO is a critical part. And if you want to grow, you have to invest on the data side, on the M&E side, because at the end of the day, the donors or the investors are having a fatigue. They want to see how much needle you have moved, how many lives you have saved or impacted, So in my 20 years of experience in nonprofit, I'm seeing a tangible benefits because of the M&E part, So I am very much, even for a for-profit or a nonprofit, the data M&E is a critical part. It's a lifeline for nonprofit if you want to grow beyond a certain level. So that's what I want. Thank you.
Yeah, wonderful discussion. I guess I have two questions. One is, when you think about decolonizing data and in particular the scientific publications, grant writing, I think we're faced with the reality that so much of this happens in English, which of course is a sort of classic colonial language, and now is very much also the language of the internet. But it has a kind of dominance. And I certainly had the experience where in many countries, native languages are highly valued for reports, for dissemination to communities, but they're really not a part of the international scientific literature. So, but they have a lot of value for people, and they, for example, can play in promotional structures in a way that peer-reviewed scientific paper may not, depending So I guess the question is how you adjudicate those discussions and commit to working with partners on non-English language publications and outcomes, if that's of value. Because I think that is a part of how you sort of share the value. And the second question is particularly for the academic sector in low and middle income countries. How much of that incentive structure for publications and other outputs plays into this? Because it is varied.
Do you want to take a stab? I think.
Yeah, I can start, and then would love for others to chime in. But I mean, the language issue, I think, is something that the field just needs to grapple with even broader than this, right? Because you know, I think it's going to be a barrier both in terms of what knowledge is shared globally, and I think it's also going to be a barrier for how global knowledge is impacting programs locally, and I think we need to deal with that. You know, within my own work, yeah, I oftentimes think about my training trajectory. So I'm a statistician, I'm a terrible writer, or was historically a terrible writer. And it took a lot of crafting and mentorship, and even some still 20 years in, fine line edits of my work to get my work to be where we need it to be. And so we try to replicate the training I needed and the mentorship I needed in our programs. And so that one formal training program, that's ideas to paper over the course of a year. A lot of that is we do this real-time editing process that Tony Harry's, some of you may know him, that he has written about, but it basically is taking two scientific leaders who may not feel as confident writing in English, or may not feel as confident, you know, English may be their first language, but maybe be like me, just not feel confident writing scientifically. And one person sits in between the two people, and they craft the ideas and work together to articulate the brilliant ideas into the language of dissemination. But I don't think that's necessarily, I think that's, given that English is the common language, that is a solution to get the knowledge out there. I don't think that's the broader solution in terms of the power dynamics that come with language, and language being the English being sort of the underlying language of the world right now. And now I'm spacing your second question.
The incentives for publication in terms of academic career trajectory.
I mean, I would love to turn that over to Thiago and Osondu. I will say, for the specific universities that I work with, absolutely, there's still like some publication metric. In a lot of ways, the universities that I have my primary partnerships with have just taken almost what I think are some of the worst of the promotion policies that we have in the US and just translated them in very direct ways. And so it's just perpetuated, but I don't, you know, that's probably in 4 universities that I partner with. So I'd be curious, Thiago's and Osondu's experiences.
I think that this is a really important question, because as Osondu was highlighting, data is the new gold of the century 21. So an expression that I don't like is that data mining. So we are using a mining approach to kind of extract insights from data. And if you think that today, the largest companies in the world are related to producing information or organizing information. So we have no longer the same distribution in terms of power as we have in the 70s and the 80s. And this, recognizing the importance of data is sometimes goes beyond the process that we are leading in one specific partnership of one specific country, for example. Let me give you one more pragmatic perspective regarding this. Right now, WHO is kind of conducting a global initiative to collect information regarding the location of each health facility available in the world, because this is the primary information that you may need to evaluate access, accessibility, to identify target populations for vaccination and for bed net distribution, trying, for example, to address malaria. And without this information, there is no way that you can use like a geospatial approach or data science approach to support countries. If you think that, okay, what should be the best approach to do this? Send a memo for each country asking for support so they can share with us the information regarding the location of each health facility. We will consolidate and use this for supporting initiatives that we have. This is exactly the type of approach that that we need to avoid when you think about equitable use of data. So instead of using this regular approach that we can solve several times in academic context, within the academic context or research, we are trying to foster local capabilities. So beyond gathering information, we are trying to identify the local needs that they may have, we have different perspectives and different situations in countries in the American regions, for example. We have countries with a very well-structured data collection process and a workflow to evaluate quality and assess and produce insights from data. And we have countries that they don't even have a computer to store the information. So the way that we are trying to do this is to identifying, so we are running we're running a survey in each country to identify the local needs so we can develop the capacity, train the personnel involved into this process, implement the structure necessary to kind of, so they can manage his own information. And only after this, we are putting together a place workflow of data sharing regarding this specific topic. And most part of the several funding agencies are requesting right now, as we discussed, we saw in the presentation, that you need to share your information. And several high impact journals are requesting, okay, if you need to publish, you need to share your database with us. And bringing how the local partners are positioned in terms of authorship as presented, and discussing the local capabilities in terms of, it is possible, for example, for a local partner to analyze his own data, to store his own information, to generate insight considering the local perspectives. It's something that we need to take into consideration to try to foster a different approach in terms of use of information. And sometimes this other perspective that goes beyond the pragmatic activities related to the research project that we are trying to implement, or the partnership that we are trying to build, are not considering, and I think that this is strongly related with this need to go beyond and think about what other activities would be necessary so we can really engage the partners and not use data as a commodity. So we can give a feedback to the local authorities, to the other countries, or local communities that are providing this very important information so we can try to move forward science. And thinking about these other perspectives, these other activities that will be necessary to kind of really engage local partners is something that maybe help us to address this type of challenge.
Yeah, thank you for that. Do we have any questions from the online?
Yes,
Okay.
we have 3 questions. The first one is, how vulnerable are the underdeveloped countries to data collection and used by more powerful nations? The second is, from whose perspective do we value data? Is it from taking into consideration the power balance between collaborators? And do we share the value? How do we share the value between the different collaborators?
So maybe we could take the second one first. Osondu, can you hear Judith?
Yes, I heard that.
Okay. Yeah, they're talking about how do you share the value?
Yeah, from
Of the
whose
data.
perspective
Yeah,
do you
from
value
whose
data?
perspective?
Yeah, thanks. I think that's a tough question. It's also a great question, I think. But I think the value that we give to data, I think, should be ideally determined jointly by everyone. And it really depends on the incentives that society has in place for the use of the data. So while it might be important to someone in academia might see data and think about papers and promotions, someone in the industry might see data and think about profits. So it ultimately depends on who is in the who is trying to make decision. And I think that there might not be a best ideal metric to value the data, but we should ensure that the people in the room having the discussion about what values the data has should be as diverse as possible, and ideally should have all the stakeholders. It is, in our own case, for example, in our own research, sometimes we think we have an idea of what to do, what data to collect, and then we talk to the country partners and they have a totally different idea. And frankly, sometimes doesn't align with what we initially planned to do. And so will need us to adjust a bit. But in the end, what we have found out is that ultimately we have stronger partnerships, we have better data, we have more engagement, and in several cases, what the local partners, that's in-country partners, have suggested turn out to be game changers. Right? And I think that we should not neglect the voice of people who are closest to the problem. Right now, I think there's a lot of power that is given to high-income country academics. I used to work a lot in Africa and used to interact with people in high-income countries. Now I live here, I work, and so I've seen this from both ends, and I think that it should be the case that we listen more to our partners. The partners really know a lot, and if we leverage the lived experiences and what that they have built over time, I think that we will do a better job. Now, this doesn't answer the question about what actual metrics to use for the data, but I think that if we have the process, it will take us there. It'll also be nice to hear what others think about this question.
I'd love to jump in there because several things you said spurred some thoughts for me. I love that comment of, the value of papers and presentations to the academic versus profits to the industry. And it reminded me of a story a colleague told me about one of her partners who had collected data, and a biobank was approached by an industry partner and offered what to the partner, who was a very grassroots organization, sounded like a lot of money. It was something like $20,000 for access to their data. But when they sat down and actually thought about what this would be worth to the person requesting, it would be like millions and millions of dollars of profit if they had access to that data and could do the things that they wanted to do with it. So I think some of the conversations about what is this worth and to who is important. Something that also came to mind, Osondu, though, thinking about your comment, and I think very probably practical for some of you in the room, is probably a lot of you as students are thinking about, like, what's my practicum going to be? Or, if you're a biostatistics student, like, where am I going to get experience at analyzing data? And so, sometimes, going to your point about like letting the partner say what is worth to share, what they want out of it, right? So I might go to a partner and say, here's a student, she's interested in these statistical methods, your data set kind of fits into the types of questions she wants to ask. Here, would you be interested in sharing that data? And again, one, I have to be willing to hear no, right? But they may just say no. And I might say, that's a terrible idea. And then I have to remind myself to check that response. But oftentimes the requests back are not for money, but it's for things like, oh, that's great. We also have this student who's interested in this experience. Could you foster that experience for them? Or the response back might be, that's great. Would you be willing to come and present in our seminar? And so I think hearing not only does it have value to different people, but the way our partners share data, they might have different expectations for what they get in return for that sharing. And so I do think it's, when we talk about open data, we're also talking about sharing data with our students, right? Which is an important part of that conversation as well.
Just going back to this this idea of what you expect back when you share data. I wanted to go back to what Thiago said about working with partners across lots of different countries, and what are the challenges you experience with sort of coming to shared priorities or the value exchange when you're trying to aggregate data across many different stakeholders for the work that you do.
Yes, thank you. Exactly. One of the main challenges, what can we offer in return to the country or to the local partners? Because makes no sense to kind of suggest for a third part or to a country partner, okay, can you implement a new work process with your funds to generate some information so I can use to produce a report or produce a manuscript? So this type of approach is it's impossible to make it work. So when we have to kind of count, first of all, we need to establish a strong partnership. And exactly as Osondu was discussing, highlight what will be the benefits and hear the local voices in terms of needs and what they are expecting, or how this new process for data collection or research may benefit the local community. Once we have this established this partnership and identify the possible feedback that we can provide for each country, it is important to kind of generate together how this information will be collected, how this information will be processed, and the most important part, how this information will be shared. Because each country may have different perspectives and they may be in a different momentum in terms of political questions or implementation of policies. And if we take into consideration just one side of the partnership to start to sharing information without following and without discussing and without getting the validation of the local partner, we may create some harm for populations that may be affected for one policy or for one specific intervention. So discussion of how this information will be shared, how this information will be processed, and how will be any other additional use of the data provided by a country. It's a very relevant matter that should be taken into consideration during this partnership building process. And it's also the data generation, when we think of data gathering process is challenging, and sometimes you have to adjust the approach that you're using, and sometimes you have to support the country in terms of data quality assessment or structure of human resources, and paying attention during throughout these elements during the process of working together. It's one good way. It is a good way to kind of leverage strong partnerships that will produce good results for the local authorities and for the anyone else interested and to better understand the local reality.
Thanks. Bill, you had a question?
Yeah, I just wondering if you guys could comment on the legal aspects, because it's one thing having an agreement between your collaborators on sharing data, sharing authorship, things like that. And it's another thing to try to get the legal framework behind it. And we've had 2 data use agreements, one completely dropped by an industry because they didn't want us to have the ability to publish data if it's something that they thought was detrimental to their business, which I understand, and we wouldn't do that. But the Duke language said we get the right to publish. And then we have another agreement that we're trying to get through right now with the Panamanian government to be able to publish their data, but having them approve that publication. But Duke is completely against any approval process because they say we're a nonprofit, a charitable organization. So if they want to share data, we should be able to use it. But it's actually threatening our collaboration.
Yeah.
Even if the Minister of Health agrees that, yes, we have this agreement that we're just not going to publish anything unless they say it's okay. But the Duke lawyers say, no, on paper, it's just a different game.
Yeah. Yeah, do you want to say something about that? We talked about that.
Because we've talked about this a lot, and I'm really just excited to be here where I feel like folks at DGHI are really pushing the boundaries on this conversation. We talked about this a little bit where, so a DUA will come before me and a partner, and first of all, I do not speak legalese, right? Like I look at this document and I don't understand 90% of it, and so a lot of it's just sitting down and really trying to deconstruct what do these things mean. There have been some places that we've been able to get them to budge on language. So I tried to highlight a specific section where it was the original language was like Harvard owns everything in perpetuity. And we were able, again, with conversations with the lawyer at Harvard, who was our point person, say, if this is what we're trying to achieve, this is why it's important to us, this is the reason why our partners are reactive, like these are the bad things that have happened to them in the past that they are trying to prevent happening. And we've been able to budge, and there's some places where they just won't move. And I think that's part of the conversations you're trying to have here, which is, what is an immovable mountain and what is just a culture shift, right? Because some of it is about true risk and some of it's about, this is just the way we've always done it that protects me, but isn't protecting the good of the science.
Yeah, and I agree. I think a lot of it is around educating people making these policies about our partnerships and how those, shared resources have to be handled in the partnerships with a lot of care and respect. Are there any other online questions? I can't actually see.
Someone says if you could talk more about equity in data dissemination.
And data what?
Dissemination back to the stakeholders and participants.
Okay, so equity and dissemination of data back to stakeholders and participants in data generation. Thoughts on? Question. I know that one thing that we sometimes do in our research partnerships is that we have a community advisory board that participates in helping us develop the research questions and trajectory, gives us feedback on the results and helps us disseminate the work that we're doing back to communities who are invested in that. I don't know if other people have thoughts.
This is not my idea, but one of the things Partners in Health Rwanda is requiring that we do, so it's me following their lead, is they have a structure for a brief policy brief and summary. And we work with the team on the ground to really make it to make it not so scientific that it's not understandable. And so anytime we have a result we disseminate, whether it's in a paper or presentation, we're required to fill this out, and then they facilitate the dissemination of that to the Ministry of Health and to the community partners.
So I think we just have like 2 minutes left. You can take maybe one more question. Go ahead.
Hello, my name is Bethany Hedt-Gauthier. Regarding data dissemination and data decolonization as well, my question is if this following approach would work. Let's say that a team is working, a US team is working with a team in Peru, and they are collecting data and they want to publish. But the current practice that I'm seeing is the publication goes just in plain English language. What if they, maybe the journals and the universities or other organizations push a little bit more and say, let's publish in Spanish as a primary language, and then as a secondary language, let's publish in English. Would that work? If that would work, then what do we need to get there? Because we're not already there. And since we were talking about data dissemination and getting back to stakeholders, at least in my case, from what I see in my country, English is not really a relevant language for, not even for academia.
Yeah.
So if I ever publish something and I do that in English, nobody in my context would be able to read it. And of course, nobody would be able to understand it.
Yeah. Yeah, I think it would definitely require some journals to, to push that, to embrace that. What do others think about that? What do you think, Osondu?
Yeah, I like the idea. It's not going to be easy, but I think it's possible. And I think it brings us back to the question of incentives and the so-called gatekeepers, right? At least in academia, we have governments for sure as gatekeepers. We also have the journals and donors, but we also have promotion committees as gatekeepers. And so at any of these points, I think that kind of requirement can be made. But not just having that requirement, but having the willingness to provide resources to back that requirement, because it's going to require people who traditionally do not speak Spanish to now start publishing in Spanish. And so doing that for the greater good of the people who are contributing this data, I think it's a good idea.
Great. Okay, thank you so much, everyone. We've gone a couple minutes over. I'm supposed to remind you that our next Think Global is October 13th, and we're going to learn about Duke's epilepsy research program in Uganda. And thank you all very much for joining. And this recording will be posted in a couple of days.
Thank you.
Thank you.